Hi, Roberto Galea and I are here talking about a randomized comparison of the Amulet device versus the Watchman Flex in left atrial appendage closure. Talk to us a little bit about what you found, Roberto.
Hello, Mike. Thank you very much for this great opportunity. So, SWISS-APERO trial is the first randomized clinical trial comparing the two most frequently used devices for percutaneous left atrial appendage closure worldwide, that are Watchman and Amulet device. So, we included 221 patients with atrial fibrillation and high bleeding risk. And these patients, after excluding electrombus and with the LA morphology suitable for both devices, were randomly allocated to implant either Amulet or Flex devices. One of the novelty of this trial is that after the implantation of the device, the post-implantation antithrombotic regimen was similar between the two groups. And another novelty of this trial is that we follow this patient with a true CT scan at 45 days and at 30 months. So the 45-day clinical and imaging follow-up results were already presented 2 years ago at the TCT Congress. And we showed that the two devices have similar clinical profile and similar LA sealing ability. We now present the results of the 13-month results, of the 13-month follow-up results. And we observed that at the 13-month CT scan, the residual LA patency is similar in both groups. We observe a residual LA patency of 53.6% in the Amulet group and 48.8% in the Watchman Flex group, without a statistically significant difference between the two arms. We compare also the two device groups in terms of device-related thrombus that was similarly low between the two groups, and even in terms of clinical outcomes. Our study was not powered to show any difference in terms of clinical outcomes, but in our sample size, in our population, we observe a similar composite rate of cardiovascular death, stroke, systemic embolism between the two groups: 9.5% in the Amulet group and 10.3% in the Watchman Flex group. So I think it's an important message that we give to the scientific community. Both devices work quite well in terms of LA sealing and are both safe and efficient in terms of ischemic stroke prevention.
And was there any difference in complications like pericardial effusion?
Yes, that's a very good point. We observe a difference in terms of procedural complication between the two groups, driven by a higher rate of pericardial effusion in the Amulet group. This was also confirmed by some other studies that compare the two devices. However, this difference was not linked to a higher risk of mortality at 1 year with our study and at a 3-year follow-up in the Amulet study. So there is this difference, but was not associated to hard outcomes long term.
And what was the anticoagulation, antiplatelet regimen used here?
So in our study, we discharge our patients in 70% of cases with the dual antiplatelet therapy, and in roughly 20% of cases with single antiplatelet therapy. We, in the results that we are going to present at the TCT, we have throughout the whole year after procedure identical antithrombotic therapy between the two groups. even at 13 months, where patients were, vast majority of patients, more than 90% of patients were under single antiplatelet therapy or no antithrombotic therapy.
Okay, great. Well, thanks for sharing with us. Thanks for taking time out, and thanks to all of you for joining us here.
Thank you too, Mike. It's a privilege.
Good seeing you.